Is Mr. Wonderman Xulu from Careworks. Wonderman, a very good morning to you. Thank you so much for being with us this morning.
Good morning.
Look, tell us more about this program. What is Careworks?
Well, Careworks, as you rightfully mentioned, is a demand creation company. We work with the Department of Health and all the other MMC partners that are in the space in South Africa. We actually have a lot of partners that we are supporting through the awareness that we create on the ground. Now, you would understand that MMC is a very sensitive topic, number one, to deal with. So to get people interested is quite tough. To get people to consent to, especially the parents of the young ones, to consent to let the kids go and actually get circumcised is actually an issue as well. So we use education to actually get the job done. We've got a lot of field workers nationally. We actually work in all the provinces. So we go to KZN, you go to Limpopo, you go to Gauteng. We've got field workers on the ground even now that are out there talking to people, talking about circumcision and getting people interested. And not only that, but educated about the benefits as well. So we don't just educate people, we also facilitate the getting them to the facilities, because we've got a lot of facilities. As you can imagine, the Department of Health has invested so much into making sure that there are facilities in every community. Now, the communities that we work with have different, there's in terms of terrains and whatnot. So the ones that are hard to reach, we make sure that we provide mobile clinics. We make sure that we get our cutting partners, like the guys that were in the studio earlier, to provide mobile clinics and whatnot. No, so we have a lot of work that we do on the ground, which helps in creating this awareness. Now, the reason why we're here today is because we want to deliver this good news. So
go ahead and
5 years ago, when we started the program, it was quite tough. And you can imagine that to trust someone just off the street with your organ, let's call it that, it was a big issue. But people have trusted us. They believed in what the Department of Health wanted to do in South Africa in terms of curbing the spread of HIV. We have done a lot of work. We've done a lot of circumcisions. This is by far the most, one of the programs which has delivered the most surgical procedures. And not just in South Africa, but we're talking continental as well. So we've got a lot of youngsters, male adults that have come to our facilities who've received this service. And we've got a lot of parents who've participated as well. We are thanking these people today. We are saying to all the males who've received circumcision today, thank you for trusting us. But let it not end there with you protecting yourself from HIV and from all these STIs. It doesn't matter who you are, in talks with, whether it's your family, whether it's your friends. You know other males out there. Talk to them. Let's keep the conversation going, and we will reward you. You just simply send us a please call me. You don't even need to have airtime. You just send us a please call me to our free SMS line, which is 0606 855 855. We will then call you back. You give us 3 names of the people that you think are interested, and we will reward you with airtime. Now, it doesn't matter where you are. You could be in KZN, you could be in Limpopo, you could be in the Vaal. Doesn't matter.
It's national.
We have facilities everywhere. We have private facilities, doctors that are working in their own surgeries that are performing this procedure. We can link you to facilities that are mobile. We have schedules of all these facilities, and we work with all of them. So we can arrange and make it easier for you to get this service and get the procedure.
Look, Wonderman, I mean, how important is such education, like your peer-to-peer campaign, looking at the current dates that are associated with the initiation season?
I'm glad you asked that, because we've been trying to get the message to the people, especially our South Africans, that circumcision is not just done in winter. Yes. We have school holidays in winter. Round about now, we are attending to the young ones that are in FETs, in high schools and so forth. they need the service now because they are available now. But everyone else who's not in school, who's not attending, can actually have the service done and come to our facilities right through the year. It's an all year round service. You don't have to wait till June. That mentality should be a thing of the past now. We should actually do our way, and we're asking the guys that have received the procedure to talk about it, to tell people that the wound doesn't have to, it doesn't heal better in winter or in summer. We have ways of making sure that we educate everyone who comes to our facility to take care of the wound and to make sure that they heal in the record time that we give them, which is 6 weeks, which is an investment. It's a health investment. People need to know that they need to invest in their health now. It's not just important to have policies and all these stock, but investing in your health is more important.
Absolutely.
Things are happening. We cannot run away from the fact that South Africa is hardly hit by the disease, but we are winning the war. This is working. This is one of the prevention methods that are very effective, and we are asking all South Africans to participate. If you're at work, we have technologies that can assist you. You don't even have to go the surgical route. You can come and we can explain it to you. You can keep watching the show.
Absolutely, yes.
Because I'm sure the minister is actually going to launch this technology in the next few months or so.
But who can approach you, Wonderman? I mean, can boys just come to your facilities on their own without the assistance of their parents? I mean, what happens? What's the process there?
All right. So we have mothers, sisters who come to us.
From which age, if I can ask also?
The procedure is actually intended for people that are between the ages of 15 to 49. But in agreement with the Department of Health, we have managed to bring down the age to 10. So we can start the procedure from 10 years and above. We can assist anyone who's interested. Obviously, the procedure is done on males, but female partners are encouraged to talk to come to us and actually even send callbacks to the number that I've given out, so that we can actually talk to their male partners or family members or friends or whoever that they think would be interested, because they know each other, and we're asking that keep the conversation going.
Absolutely.
Let's get South Africa healthy.
Thank you so much, Wonderman. And once again, remember, interested folks can send a please call me. We do have the number on the screen there. And of course, you will be rewarded with airtime. And of course, we're going to take a very quick ad break with that. And we'll be back with more news. Do stay with us.